Assalamu alaikum, my dear students. I hope that you are all well by the grace of Almighty Allah in this crisis day of pandemic corona. Today I shall talk about the tuberculosis, and you know that tuberculosis is a chronic granulomatous disease. TB has affected humans for millennia, historically known by a variety of names, including consumption, as it consumed most of the nutrients from the host. It is also called wasting disease because there is wasting of the body in great. And white plague, I don't know why it is called white plague, but the popular name of tuberculosis is phthisis. In this subcontinent, the phthisis was a big challenge to the society, and TB was a death sentence for many. Transmission of tuberculosis spreads person to person through the air via droplet nuclei. And by this time, you know that droplet infections, because coronavirus spread by droplet infection. Mycobacterium tuberculosis may be expelled when an infectious person coughs, sneezes, speaks, or sings. And transmission occurs when another person inhales the droplet nuclei. You see the red drops, all are the droplet nuclei and all contain Mycobacterium tuberculosis. It spreads throughout the lung. The primary site of tuberculosis is usually lungs, and the incubation period varies from 6 to 8 weeks. During the incubation period, the following things are occurred. One is formation of primary complex. I shall go in detail later on. And in this incubation period, some of the organism may escape into the blood and causing miliary tuberculosis. Conversion of tuberculin reaction. The individual becomes tuberculin positive during this incubation period. Or there may be formation of pleural effusion. There is fever and flacular conjunctivitis as well as erythema nodosum. In fact, all these are allergic manifestations of tuberculosis, mainly the primary tuberculosis. And this is a MCQ question. You may ask the question that the following are the allergic manifestations of tuberculosis. 3 may be positive or 2 may be negative. So you should remember. And sites of tuberculosis, as I told you, that the lungs is the important site, and pulmonary tuberculosis occurs in the lungs in 85% cases of all cases of pulmonary and extrapulmonary tuberculosis. And extrapulmonary tuberculosis occurs in places other than the lungs. The sites includes larynx, lymph nodes, brain and spines, kidneys, bone and joints. Miliary tuberculosis occurs when the tubercle bacilli enter into the bloodstream and are carried to all parts of the body. Under the clinical pathology, you know the details of pathology of tuberculosis in your third year, fourth year classes, but I shall tell you about the clinical importance of the pathology. There is inhalations of the tuberculosis bacilli. And this tuberculosis bacilli, they settle down at the periphery of the lungs, which is called subpleural space. Also, there is small caseous focus in the lung parenchyma called primary focus or Ghon's focus. Sorry, it is Ghon complex written, but it should be Ghon's focus. And from the primary focus, the organism spreads via the peribronchial lymphangitis and spreads toward the bronchopulmonary and tracheobronchial lymph nodes on the same side. And the lymph nodes are affected, causing lymphadenitis. So there are three things. One is primary focus, which is at the subpleural regions of the lungs, lymphangitis, and regional hilar lymphadenitis constitute the primary complex or Ghon's complex. And this primary complex or Ghon complex is also important for your SAQ question, short notes, or MCQ question. So, but to remember what is primary complex. The primary complex constitute by the primary focus, lymphangitis, and regional hilar lymphadenitis. Please remember. Now the fate of the primary complex. Initially, I should talk about the fate of primary focus. The primary focus usually heals by calcification, and the calcium is absorbed into the circulation, and there may not be any trace of primary focus. Or there may be local spread towards the lungs, and this is called progressive primary tuberculosis. And in the process of caseation, the caseous materials deposits in the consolidated area or in the progressive primary tuberculosis area, and there may be, it looks like abscess or there is abscess formation. And in the process of caseation, the bronchus may be invaded and the product of abscess is coughed out and remained a cavity, so there is cavity formation. And along with the bronchus, there is vascular bundles when it involves the venous system. The organism enters into the heart and thereby goes to the general circulation and causing miliary tuberculosis. Then pleural involvement, when the organism spreads outwards to the pleura, there may be pleurisy. At that time, the patient may experience pleuritic pain, and you may get the pleural drop. And then there may be pleural effusion, and when the large number of bacteria enters into the pleural space, there is formation of empyema thoracics. When the pleural is connected with the bronchus, there may be entry of air into the pleural space that may cause pneumothorax. When the primary focus or progressive primary tuberculosis is near the heart may be involved and occurs pericarditis. And there may be dry pericarditis or there may be pericardial effusion. And the main features of tuberculosis depends on the involvement of the lymph nodes. And the lymph node may press over the bronchus, causing partial obstruction, and in that case you may hear the wheeze. Or when there is complete obstruction, there is collapse of the particular lobes of the lungs, and you will get the features of collapse. The bronchus may be eroded by the process of caseation. And when the outer layers of the bronchus is eroded, and you know that the another features of tuberculosis is granuloma formation. And there may be formations of granuloma in the wall of the bronchus, and which may protrude through the mucosa into the lumen of the bronchus. And this is called endobronchial granulation tissue. And this endobronchial granulation tissue allows the air to enter into the lungs, but it does not allow to egress the air from the lungs. So there is accumulation of the air in the lungs parenchyma, which is called pulmonary emphysema. And there is erosions of the blood vessels along the bronchus, and when the artery is involved, the organism enters into that particular lungs, causing miliary tuberculosis of lung. When the organism erodes the venous system, then it spreads via the heart to the general circulation and causing miliary tuberculosis. So the hematogenous disseminations, there may be silent basilemia. The organism may settle at different organs without causing any symptoms initially. And these sites are Simon foci, these areas of calcification in the upper zone of the lung. And these Simon foci later on reactivated in the name of Ashman's focus in adult life. There is Duchenne foci, similar lesions in the spleen, and the Rix focus, similar lesions in the brain. And this Rix focus is important because the tuberculous meningitis may occur from the ruptures of this Rix focus. And there may be acute miliary tuberculosis, which occurs within the first 6 months of primary infections. All the organs, all the organs are started with small tubercles. And there may be chronic disseminated tuberculosis. It occurs, or the manifestations occurs usually after 3 to 4 years of primary infection. The bronchogenic spread. There may be acute tuberculous pneumonia. It occurs when the bronchus is eroded. The organism enters into the bronchus and spread to that particular lungs, either in the lobe or in lobular fashion. And when the large number of organisms enters into the bronchus, and it may cause galloping consumption with high fever. And this tuberculous pneumonia, including galloping consumptions, are confined to young infants. And in bronchogenic spread, there may be cavitation, there may be spontaneous pneumothorax, and tuberculous empyema. These are the common complications of tuberculosis. The chronic fibrocaseous tuberculosis or fibrocaseous this type of tuberculosis is common in adults. There is infiltrative focus of activity under one clavicle, and this focus is called Ashburn focus. And I told you earlier that Ashburn focus is the reactivation of Simon focus. Now the clinical features of tuberculosis. The tuberculosis may be asymptomatic or may present as allergic reaction, which I told you earlier. That may include flagellar conjunctivitis, erythema nodosum. Do you know the other causes of erythema nodosum? Most common was rheumatic fever. Now the rheumatic fever is not a common condition. There may be some non-specific symptoms like loss of energy, lethargy, or the child may become undue irritable, anorexia, and there is loss of general well-being. And the common features, we believe that there is evening rise of temperature, and there may be loss of weight or failure to gain weight, and there may be symptoms due to pressure effect on surrounding structures. There may be cough from the pressure by the main bronchi. There may be wheeze due to pressure by the main bronchus, pressure on main bronchus, and there may be stridor when the trachea is compressed, and there may be chest pain when there is pleurisy. And the tuberculosis should be suspected in any child or in any individual when the cough persists for more than 3 weeks, fever persists for more than 2 weeks, and there is loss of weight or no weight gain for the last 3 months, and loss of interest in playing, and features of extra pulmonary tuberculosis you may get according to the site involved. Now the diagnosis of tuberculosis. As earlier I have told, the tuberculosis should be suspected in some situation, and there is the clinical features. So if there is clinical feature suspected for tuberculosis with the history of contact with tuberculosis patient, and contact means contact with a known case of tuberculosis for a prolonged period, and especially if the contact and the individual lives lives under the same roof, and it is common in barrack, bosti, etc. After suspicion of tuberculosis, you have to do some diagnostic test, and one of the diagnostic tests is complete blood count. In complete blood count, you will get the high leukocyte count with high lymphocytosis, and this is called absolute lymphocytosis. And you know that there are other causes of absolute lymphocytosis, and you have to know amongst these are two important ones. One is pertussis, another one is infectious mononucleosis. And this absolute lymphocytosis, one of the important question for MCQ. So please remember. And another test is Mantoux test or tuberculin test, then chest X-ray, gastric lavage or sputum. In children, sputum usually not available. It swallows the sputum, so the gastric lavage is important. And in any case, either gastric lavage or sputum should be 2 samples. And you can take the laryngeal swab for the study of tuberculosis and ALS, antibodies in lymphocyte supernet. And the recent test is gene expert test, gene expert. And you know how to perform the tuberculin test. 0.1 ml of reagent containing 5 tuberculin units of tuberculoprotein is injected intradermally, please remember intradermally, into the anterior aspect of the forearm. And after 72 hours, development of any induration is observed and measured. And the empty test is regarded as positive in severely malnourished child if it is either 5 or more than 5 millimeters duration. In other children, it is either 10 or more than 10 millimeter duration. This is how the tuberculin test is performed. You see that there is a wheel at the site of injection. As it is intradermal, the injection should be given in the skin, so there must be some wheel formation. And after 72 hours, you have to measure the duration, not the redness. So you will draw the line when there is blockage or there is speed breaker. You mark them, and surrounding area should be marked first, and then it should be measured by a tape. ALS, it is an immunological assay to detect active disease like tuberculosis. The advantage of ALS is early detection of active tuberculosis in both adults and in children, and the results are found within 3 days. This method does not require a specimen taken from the site of the disease, and it is high sensitivity test. And the secreted antibody can be preserved for a long time for further analysis. But there is disadvantage that it cannot done ALS if the individual has taken M2 for 3 months earlier or within 3 months. Excess test. And in this film, you will see that there is a small primary focus and there is enlargement of the lymph nodes, lymphangitis, and this is called primary complex. And I told you that there may be cavity formation, and there is one cavity on the upper zone in one film and the lower zone in another film. And this is typical of miliary tuberculosis. Small millets like pairs surround in the whole lung fields. So miliary mottlings involving whole lung fields. It is miliary tuberculosis. And another complication of tuberculosis is pleural effusion. In the earlier I told about pleural effusion, which is allergic, and now it is the pleural involvement. It is pleural involvement, and there is crescenting upward shadow with loss of cardiophrenic or obliterations of the cardiophrenic and costophrenic angles. This is also the features of pleural effusion, but the cardiac shadow is large, so there is pericardial effusion. So it is pericardial effusion with left-sided pleural effusion. Now the treatment, and you know that there are some drugs which are sensitive to tuberculosis organisms, and there are first-line drugs, and the first-line drugs include isoniazid. The dose is 5 or 4 to 6 mg per kg body weight. Rifampicin, in short it R, 10 mg. Pyrazinamide, is abbreviation is Z, and ethambutol E, and streptomycin S, and all are in milligram per kg body weight per day. Now the recommended regimen for treatment of the tuberculosis in children. There are few categories of tuberculosis. Then one is category 1. In this case, smear positive with pulmonary TB, but in children, tuberculosis may be with smear negative. And different forms of extrapulmonary tuberculosis other than tuberculous meningitis, and if there is concomitant HIV infection. And in this category, the intensive phase, that is with all the drugs like ionase, rifampicin, pyrazinamide, and in some cases, ethambutol, and it should be given for 2 months in intensive phase and 4 months as continuation phase, and in continuation phase only ionase and rifampicin should be given. In tuberculous meningitis, there is lots of regimen, and some says initial phase 2 months and continuation phase 4 months. But in children, we suggest, and the guidelines is 2 months initial phase and 10 months continuation phase. In category 2, this includes previously treated smear positive pulmonary tuberculosis, and then relapsed tuberculosis or treatment failure tuberculosis and uninterrupted case management. And in this case, intensive phase either 2 months or 1 month, and the continuation phase is 5 months. And chronic and multi-drug resistant tuberculosis, specially designed standardized regimens. And there is a question: is ionized can be used as preventive therapy? Yes. In some cases, preventive therapy, prophylactic ionized therapy is given, and the situations are if there is pulmonary tuberculosis in the family and the children under 5 years, contacted with tuberculosis patient in family for the last 1 year. And malnourished children getting steroid or chemotherapy. And in this case, there should not be any signs of tuberculosis. And ionase should be given for 6 months. Single drugs, ionase to be given for 6 months. You have to know about the side effects of important drugs. Of them, INS, it causes peripheral neuropathy, rifampicin, hepatitis or jaundice, and ethambutol and streptomycin ototoxicity. And these complications or the side effects of anti-tuberculosis drugs should be kept in mind. Though there are other side effects of other drugs, but these three drugs are important, or 3 or 4 drugs are important, yeah, and you have to remember these side effects of INS, rifampicin, ethambutol, and streptomycin. This is all in short about tuberculosis. I hope you will be benefited in these days of pandemic corona. Thank you very much.